Oh, yeah.
So,
here we go.
For those of you who don't know, streaming just went up 9% over cable.
Oh, I don't doubt that a bit.
I believe that.
So streaming is beating cable right now. Within 1 year, it went up 9%.
I don't doubt that a bit.
So that makes you ask the question: how does cable survive? So they survive by commercials, right? But guess who the number one advertiser is? 75% of all advertising on cable TV.
Pfizer.
Big Pharma.
Pfizer.
Big freaking Pharma, man.
Imagine that.
Big Pharma. I heard that.
That's sickening.
I was like, oh, it was in the Wall Street Journal.
That's sickening.
I was like, you got to be kidding me. Big Pharma.
It's sickening.
It is sickening.
It's absolutely sickening. All these damn pills and all this mess.
Well, what's really sickening about it is they're taking a profit to turn around and do that instead of cutting people deals. Like, if people depend on insulin, instead of making insulin cheaper, you got people on maintenance drugs that they'll never get off their whole life.
And they milk them.
Yeah, instead of making it cheaper.
They freaking...
Yep.
And I watched that show.
Painless?
Painless. You want to talk about something that was just absolutely...
Oh, Painkiller.
Painkillers on Netflix.
Painkiller.
Did you see that?
No.
It's about the
Oxycontin.
Sackler family.
But is it West Virginia or no?
It's about Oxycontin.
It's everything.
And how they came out with it and why.
Purdue Farm.
And why
Purdue
they came
Farm and how they peppered the entire country with opioids. It's absolutely ridiculous.
What was in it? I had no idea.
It was basically legal drug dealing for. Well, they did lie. First, they come out and said that it wasn't addictive at all.
Oh yeah, they
because
did.
it was time released and it wasn't addictive at all.
Yeah,
and
then after that, people it stopped working for some people. So then they come out with the sale campaign, up the dose. So then they started making 15s and 20s and 30s and 60s and 180s. For what? Who needs a 180 milligram pain pill?
Oh, so when her and I were watching the other Netflix show that came out, which was the Johnny Depp Heard trial.
I watched that too.
But on him, he was
that.
addicted to Oxycontin.
Yes, he was.
Right, but
who wasn't?
Yeah, the people. I've never had them.
Yeah,
so thank God. Want them. Thank God. But the interesting thing is the guy who designed that, right? The family,
Sackler family.
They were going broke. Like the old man died, and that was their only hope.
Vicodin was their big drug at the time.
I remember hearing Vicodin.
And then what they did is they took what was it, heroin? What else was in?
Well, they took an existing pain pill that they had, and they candy coated it with time release.
Yep.
And claimed that it was not addictive, and you could live painless without addiction.
Yeah.
And said it was safe.
Yeah, it was like heroin, Percocet.
And they used a letter to the editor as their scientific study, saying it was safe. When the doctor that wrote the letter to the editor, it was a controlled study. They were, and it was like I think it was like 10 people.
So you wonder how much that doctor was paid?
Oh,
he wasn't paid. He didn't even realize at the time that they was using his letter to the editor.
Oh wow!
As a scientific study.
Is that when they put it through the FDA, they finally got a guy who actually cared. And it took them a long time.
They couldn't get it approved.
They bribed him. They did all kinds of stuff to get it approved. But then finally, he approves it. A year later, he quits and goes and works.
Goes to work for Purdue Farm.
Went and worked for him.
That's how it always works out. People in government will leave the government and go to work for him.
That's what he did. That's why all these pill mills popped up, because it was they just flooded the market, and they were writing scripts for headaches.
Oh yeah, they were,
because it was safe.
And they had all these good-looking girls running around selling it.
Yeah, until
good-looking men, good-looking women.
Until they started noticing that the crime was starting to pick up in these neighborhoods. Pharmacies were getting robbed. You got to have an armed guard at a pharmacy. It
was unbelievable.
So it got out of control. But it's still out of control.
It is. So that goes into the thing that you were talking about, since we started